Thanks. First of all, thanks everybody for coming today. I'm Linda Raftree. I'm going to be the kind of MC on today's Tech Salon. Thanks for joining us. We've been doing Tech Salons for a little over 10 years in different cities around the world, really trying to bring together the tech sector and the development sector. And in this case, our focus is COVID-19. The idea behind Tech Salon is really to have the kinds of conversations that you like to have at conferences, but often don't get to have. So we're going to try to make it as personal, as engaging as possible. That's why we would like you to have your videos on so that it can almost feel as close to in-person as possible. We've been running the New York Salon since 2001, and we have some people here who've been running other salons. Wayne is here, Chloe is here, Kat's here. For this one, we're partnering with a few organizations. Our sponsors for the salon are Dial and the Principles for Digital Development, ThoughtWorks, and Pivotal Act. For this particular first salon in our series, we have Ali, Allana, and Andy, who have been the main organizers on this particular topic. And that's really how we decided to do some virtual salons was folks were saying we really want to bring the tech sector and the humanitarian and crisis sector together so that we can discuss a bunch of different topics. We're going to be doing a few more salons. Our first one after this one is going to be hearing from folks in Uganda and Pakistan on how they're addressing and kind of what's going on with the crisis in those two countries, hearing from organizations that are working there. Our third salon in this particular series is going to be around ethical data approaches to the COVID crisis. Our fourth one is going to be looking at how to responsibly engage in volunteering in hackathons. And then the last one in sort of our current set of 5 is going to be around what would be the best role for corporations and foundations to play in the crisis. Today's topic is really about setting the stage. And we wanted to bring in folks that are really eager to work on tech solutions and tech initiatives, people who want to do stuff with their tech skills, and then folks that have been involved in past crises. So we have speakers who were working actively in the Ebola crisis, for example, very specifically on tech responses. And so we wanted to see what we could learn from them in this particular crisis so that we're not repeating mistakes, so that we're not reinventing wheels, so that we're understanding kind of what are some of the best practices that we can engage with as we're working on the COVID crisis as a technology sector. Today, we're going to focus a little bit on health, but we know that there are a ton of other things that are starting to really emerge. We've got issues with the economy and jobs. We've got everybody trying to do online education. Everyone's trying to work online. We've got domestic violence coming up. Child abuse coming up when kids are kind of in homes with abusive parents. We've got mental health issues. We've got people bringing up issues of substance abuse. So there are just a ton of things that are starting to emerge from these different crises. And then the nature of the virus itself is really pushing to a digital response to all of this. So in the face of all of these new things that are emerging, we're also trying to change the way that we're all working because we can't be face-to-face with people. So this is kind of the setting that we're in right now in this particular crisis that we want to kind of look at this broad picture of it today. What you can expect today, we've got 4 speakers who are going to kind of do some level setting. Then we're going to do some Q&A, so you can type your questions into the chat for speakers, and then a few of us are going to be consolidating questions and bringing questions out to the speakers who can then discuss some of the issues that you're bringing up. This first part is being recorded, so we'll only record the first piece. Then we're going to move into breakout rooms, and we're going to try to break you into about 5 breakout rooms with something around 20 people in each breakout room so that we can have a more intimate discussion. Our speakers today, we have Marek Schaffer, who's the digital health lead at USAID. We have Larisa Fast, who's at University of Manchester. Alanna Shaikh from Health at Global Public Health at Tomorrow Global. And then we have Allana Nelson, who is leading on the Principles for Digital Development at the Digital Impact Alliance. So I'm going to end here and pass over to Merrick. Again, if you have anything that comes up, feel free to type anything into the chat. If you're having technical challenges, Andy can help you with that. And I'm just going to pass right over to Merrick now.
My name is Marek Schaffer, and I am the Senior Digital Health Advisor at USAID, or one of two, where I work with the entire agency, but specifically with the Global Health Bureau around implementing digital health solutions around the world. And I got into development from the tech sector. I was a developer in the private sector, working on a lot of financial systems for about a decade, and then pivoted a little bit and ended up at UNICEF, where I was a software developer there, working on keeping the 194,000 web pages that UNICEF hosts and runs up and functional. But within a few months of me joining, we started getting questions from leadership around how can we apply a bunch of emerging technologies that were nascent at the time. So this was before iPhones, before the big social networks took off. So there was MySpaces and YouTube, wikis. And so how can we apply those in the context of development? And so a bunch of us kind of like rallied around this, and then ended up in a skunkworks where we, which later became a formal part of the institution, the UNICEF Innovation Team. But the first few years, it was a skunkworks of a bunch of developers, a few designers, some management consultant folks, who all were trying to apply technology, new ways of working, design in the context of development. All right, so at UNICEF, we ended up co-founding the UNICEF Innovation Team. And I was saying that we failed a lot. We failed a tremendous amount on our first few years. And that's what I'm gonna focus on talking about, is sort of why we failed and what we learned from that, and how you can bring, hopefully, some of those lessons and those experiences from our explorations in trying to apply technology to low resource settings and for novel problems to what you're doing and bringing to bear for the COVID response. And so after UNICEF, though, I went to the World Bank and worked on very large scale ICT programs, often run out of national ministries in agriculture, education, and health. I then ended up at USAID, where I led the Ebola data team during our response and recovery efforts for Ebola. And now, as I said, I'm working on the COVID task force at USAID. Getting tech to work in any setting is hard. Getting it to work in settings you're not familiar with, or settings that have major resource constraints, is even harder. And oftentimes the sort of mistakes that are made are not made, are made well-intentioned, and oftentimes they are made in ways that lead from having thought things through ahead of time. So I'm gonna give an example of a failure that we had, and then kind of back that up to what sort of impact that could have. So early on at UNICEF, this was like 2007, we threw a hackathon. There were a lot of devs that wanted to participate in what we were doing and try to build open source tools to help children around the world. And so we had a hackathon, and we identified a number of areas where we thought that tools could really help, technology tools could really help. And one of them was community radio. We knew that in Kenya, there were a lot of community radio programs going on, and UNICEF was doing a lot of work in that area. And so within a matter of hours, we hacked together a Linux-based community radio station. So this was on a USB memory stick. You could plug in any computer, it'd reboot into Linux, and a radio station interface would pop up. And it would give you the ability to cue tracks, to take a mic, to be able to interview people, to link to other things, to download resources. And it was everything you needed to run a radio station. We then ran down the street to Radio Shacks that still existed back then, and bought an FM transmitter, the kind that you would connect your iPhone to your car radio with, took it apart, wrapped the antenna with copper wire, soldered that to some Cat5, soldered that to an umbrella, and then ran up to the roof of the UNICEF building in New York City and like aimed it. And we found that we had a directional antenna that gave us about a mile of broadcast. And so we essentially, in the course of an afternoon, built everything you needed to run your own little community radio station. But of course, like we knew that like doing that in New York City, which of course was illegal, standing on top of the UN building, like broadcasting radio, was not enough, and we needed to take it to the field. So we ended up bringing it with us on some other work that we were doing, and we went to a bunch of villages and showed people this tool and had them play with it. And radio is really always perceived as a one-way medium, like it's something that comes at you. And so when all of a sudden we gave people this tool that gave them a voice, that other people within their village could hear them speaking, it was like the reaction was amazing. People like cried, they laughed. It was like such a powerful experience, a moment of empowerment of these communities. And we were like, whoa, we did it. We like, this was a super fast, low cost, like low tech solution that really will have an impact. But it was a complete failure. Why was it a complete failure? And there are two main reasons. One is we didn't involve anyone else from UNICEF other than our innovation team in this process. So we're sitting at one of the premier UN agencies that does development work to support children around the world. All of these experts that have been doing community radio programs for years, we didn't involve a single one of them in any of it. We had just focused on the solution, making the tech work, testing it with what we perceived our audience to be. And our colleagues had no idea what you could do with that. That wasn't having your own small scale, directionally limited like radio station wasn't something that anyone had ever thought about. And there was no way to integrate it into our programs. That was the first reason it failed. The second reason it failed was it was illegal. As you know, like in most countries, you can't just spin up radio stations. There's policies and regulations that like our own FAA has here in the US that limit you from being able to just like spin up a radio station. So we had built this amazing, cool tool that like worked out of the box and was very cheap and worked in the environments we needed it in. And it just wasn't providing any value at all to UNICEF's programs. But of course, these types of stumbles aren't just silly, fun stories. They also can have detrimental impact on our programs and on frontline workers. So if you think about it in the COVID response, someone spinning up a tool that empowers a frontline health worker, maybe a community health worker, so someone who has a low amount of training but high level of engagement with their community to be able to help do like triage or testing within their community, which then encourages them because they have this new tool and gives them the ability to go to members of their community and actually check them for symptoms without, say, proper PPE, that could actually put the health worker's life at risk. And so I think like one of the real challenges with getting the technologies to work, which is hard enough on its own, is also understanding the second order impacts that come from unleashing unproven and untested technologies into environments where they haven't been before. And so I'm really excited with the presenters that are following me. Like from those failures, we eventually led to successes, and we discovered probably the best technology that we discovered, still using it a tremendous amount these days, is the basic cell phone. It was everywhere. Everyone around the world had access to one if they didn't own one themselves. And as devs, we saw that the texting SMS is like a command line interface. And so you could have someone send in a structured SMS and our servers in the back end could parse that and make sense of it. We built all sorts of applications that just used really simple commands on a very basic phone that people already had in their pockets. And it's that ability to sort of reuse what people have, to stick with the familiar, to leverage open tools that really let us have the impact that we did eventually have on that innovation team. And some of those technologies are still up and running as the national HIV real delivery system in Zambia, for example, or the 300,000 person U-Report network of youth in Uganda. So really trying to understand what tools work and what tools don't work in the context you're in, and what the users need, how to build those tools in a way that's open and with the users is really, really critical. And so the speakers that are following me are going to sort of unpack some of these aspects of lessons learned and frameworks. Probably the most important framework we developed from all of those led from an angry email that I wrote. Basically how we were making the same mistakes. I love making mistakes. I hate making the same mistake again and again. And we found our team was making, one group in Mali would be making the same mistakes as another group in Botswana. And we were like, what is going on? Like, why are we making the same mistakes? We should be learning from each other. And so we ended up writing down a set of principles that we thought would be useful for our team to try to follow, a set of heuristics, things to think through when trying to design technologies in a low resource setting. And those later got refined, and a lot more people beyond UNICEF joined in those efforts. Initially 13 different UN organizations and big development partners, and now 200 plus organizations have participated in developing these heuristics and principles. And Allana Nelson is gonna close this Tech Salon talking about those principles of digital development. And another set of lessons that we really learned specific to outbreaks was Larisa Fast, Dr. Larisa Fast, who's directly following my speaking, was embedded in our team for 2 years while we focused 24/7 on the West Africa Ebola outbreak. And we specifically to try to capture what worked and what didn't work in information, data, and technology. And so she's going to bring some of the highlights from that research and that work. Ended up being published as a report that interviewed over 130 people across the Ebola response, many of which were deployed in country. And then the other real thing, like this is a health crisis, and the tools and solutions that get developed need to be embedded within the health context. So Allana Shaikh is going to talk about how to do that and think about the health context itself. So with that kind of introduction, definitely develop solutions, think through what you're doing, but also try to understand the context of what the tool is and think of ways to actually work directly with the user. Coordinate with others. If someone's building a similar tool, join efforts with them. Don't try to outcompete them. Be open, be transparent, and have a great day.
Great, thanks Linda and Merrick for that introduction. As Merrick mentioned, I was working with the USAID team that was focused on data and technology in the Ebola crisis. And I'm also speaking about some more recent research that I've done on local humanitarian action and a forthcoming synthesis report from the Humanitarian Policy Group on that topic. So I have 4 basic lessons that I'm going to share today. One is that tech is important, but even more so are people and process. So tech is only one part of a successful digital project or intervention. Successful uptake really requires human and institutional systems that enable that technology. So those might be less exciting, but they're really crucial to the effective deployment of technology. So you might have a great new digital tool, but will people know how to use it? Will people trust the technology that you are using or that you're trying to deploy? So, things like training may be really important, but the time and ability to do that training might be very limited. But it's also about trust in people. And so one key aspect that we learned from the Ebola response, which I think is equally true in the COVID pandemic, given the extent of misinformation and disinformation that's circulating, was the absolute importance of trusted actors in sharing information and prompting people to change their behavior. So, need to integrate these technologies into existing processes, and I'll talk a little bit more about that later. One thing that we learned also was Excel was the backbone of the response in many ways, but even that wasn't easy. It was a simple, or a potentially simple technology software to use, but it was also things like we had missing data points where people would report 0 cases instead of having, using some other character to denote missing data, which skewed the reporting that came out. So things like that, it may seem simple, but it usually is not quite so much. Lesson 2 is about the importance of context. And here, I think it should go without saying that tech needs to be embedded into the local context. That might be organizational, cultural, or national cultures. In the West Africa outbreak, there was weak infrastructure, gaps in reliable electricity or digital connectivity, as well as roads, and that hindered the sharing of information, including very basic things like case data. Again, I mentioned trust before. That's very much linked to context, things like social relationships, but also the political context. Do people have trust in the authorities, and then will they believe the information that is coming out from government authorities? So what that means then is that one-size-fits-all solutions are unlikely to work. It's really important to think about support for local actors. Technology should amplify local action and not usurp it. And also things like tech tools should be deployed and used in offline as well as online environments. And if they're not able to do it in both, in situations where you have those connectivity gaps, your solution may not function. Another thing is, don't always assume then that you might be the only actor to come up with a solution. You might have many local actors, communities, authorities, either local or national authorities, other trusted actors such as community leaders or faith leaders who are already responding in their own communities. They may be doing something similar, and their work will inevitably be more contextually appropriate, and it's much more likely to continue long after those of us who are not from that context leave. Lesson 3, think incremental as opposed to game-changing. Technologies that are introduced are less likely to be game changers, but instead they might introduce incremental improvements. So one key way that digital tech helped in the Ebola outbreak was linked to things like feedback loops, the ability to reach more people more quickly, such as through mobile phones, as Merrick mentioned, that allowed Ministry of Health officials to share key information with local health workers via their mobile phones, or the ability of individuals to send in rumors that were circulating in their communities or misinformation that could then be addressed through some of the official messaging or trusted messengers who were providing that. So, as a consequence, it might be more effective to reuse and adapt already existing tools rather than introducing new ones. Another thing is to be aware of fragmentation. If there are too many systems that are deployed, then it creates information overload and increases what we might call the signal to noise ratio, where it makes it much more difficult to determine what works and why. The other thing is about standards here. Data were collected, used, and stored in many, many forms during the Ebola outbreak, both paper and digital. And some of the same challenges were relevant to both of those sources. There were some key gaps, things like missing unique identifiers. So someone could present to one Ebola treatment center and then present to and be sent home and then go to another one. And those would be counted as 2 cases rather than 1 case because of a lack of unique identifiers. We had a lot of data that were not available in machine readable formats. So they would be published as PDF or in PDFs, embedded in PDF documents, and then not available to actually be transmitted easily into other formats. Also, things like definitions for cases were slightly different across countries. So for the COVID outbreak, I know in some countries, the official death counts actually include only people who die in hospitals, and they may not include people who die at home or people who die in care homes or nursing homes. Do the death counts include probable cases or only those who are tested? And then finally, on this point, preparation is crucial. Crisis can definitely be an opportunity, but it's not necessarily a time to introduce massive change because people are already trying to cope with uncertainty and change. And so that incremental approach might be more effective. The 4th lesson I'll mention fairly briefly with a shout out for the 3rd Salon is don't forget ethics. I could say a lot more, but I will just end with a plea to think about the ethics of your work, including things like data protection, data privacy, what data you are collecting, how you're storing it, how you're sharing it, and how you're using it. Data responsibility is definitely about privacy and data protection, but it's also about things like not collecting more data than you need and using what you actually collect. Data privacy and data protection are also individual as well as group in their nature. So you may be able to protect individual privacy, but you may not be able to protect the privacy of groups who are vulnerable. So particularly when data sets are merged. So that's something to think about. And then the final thing I'll say on this is that I think we shouldn't be experimenting with new tools and new technologies on populations that are already vulnerable. And so to think through those ethical questions very carefully when you are developing your technologies. So I will stop there, and thanks to Linda and all the organizers for giving me this opportunity to speak and share. Thanks.
So Merrick and Larissa did a really terrific job of covering sort of the general issues around tech, and specifically tech in crisis and emergencies. And I really liked the point that a crisis is not the time to start pushing everyone to learn something new. That, you know, that when everything is changing and your job has suddenly gotten vastly more difficult, that is not the time when you want to also learn a new technology. And I think that's a really key point. So I wanted to talk about a couple of things here. And one of the things I wanted to talk about is the sort of proliferation that we're seeing of like COVID-specific apps and technology coming out. In particular, consumer apps and people designing things aimed at healthcare workers. And this idea that sort of is that like we can solve this with a phone app. And then I'll step up sort of into the role of what I think are some opportunities for the tech sector and some problems that might actually have technological solutions. So to start by talking a little bit about this whole app issue, that I think that some of you may have seen in the news that a couple of apps have been run into trouble for claiming that they can diagnose people with COVID, like through a questionnaire on their phone. There have been apps that have been issues around data privacy and where the data is being shared. Now, if you're going to develop a COVID-specific app, there's really sort of two users who benefit from this, two sets. One of which is like the individual who has this app on their phone, the individual who wants to get health data from it, who's relying on it for that specific purpose. And then your second consumer is basically collecting demographic information for governments or local health departments. And both of those functions have some pretty major issues going on. One of which is that if you're trying to provide health information to an individual about COVID-19, the challenge is that this information is actually very, very location specific. If you want to tell people when they should get tested, what are the symptoms that mean you should get tested, that is going to differ by even county by county in the United States. If we're looking in foreign countries, it's not necessarily going to have a single national policy. So that's very location specific. The policies around quarantine, around self-isolation, around how to behave when isolating are, again, sort of municipality specific. There's a tendency among app developers to assume that there are like general health information and general health rules, and all we have to do is give this to people. And the fact is COVID-19 is evolving so quickly and we're learning so much about it that there aren't these sort of general sweeping rules that we can give to everybody, at least not in a way that's actually useful. We can tell everyone to wash their hands, but I feel like that message has largely gotten through. If you think about the information on masks, even now, like Canada is not recommending that everybody wear a mask when they go out in public. The United States is. Like even things that seem like they should be general and obvious are in fact not. So if you're trying to provide specific actionable information to individual people who might have COVID-19, who might be trying to avoid getting it, it's difficult to provide information that is universally relevant and specific enough to actually be valuable. Another thing to think about is a lot of the stuff that keeps people coming back to apps, that makes people want to keep logging back in, isn't necessarily good for mental health. I had a group who was working to develop something come to me, and they wanted to have like a symptom checker where every single day you would open the app and you would input your symptoms, and it would tell you whether or not, you know, you should go get tested. And, you know, that is a perfect way to make yourself crazy. Like, there are real mental health issues around that. I could see a value to an app that lets you track your symptoms once you've been diagnosed. Then you can track the progress. But like, for people who don't have a diagnosis, who haven't been tested, you know, sure, it's going to keep them logging in, but it's not going to be good for them. And I think we can all agree a health app should probably actually be good for you. There's also a lot of PII, personally identifiable information, that people input to health apps, and you need to be thinking about that up front. And for a company that's designed other apps or created other things but has never worked in the health area, all of this stuff tends to be new to them, and they don't tend to be thinking up front about this and how to use it. Now, your second sort of end user around an app like this, which is that your municipality or your government, for whom it could be really handy to know, like, you know, how many people say that they smoke in this area, or, you know, what are some demographic breakdowns, because not every country, not every area actually has that kind of granular information on their population. So that's genuinely useful in terms of trying to predict how hard COVID's going to hit. But again, we've got some serious data privacy issues going on, and people need to know that that information is going to be shared and who it's going to be shared with. So that's sort of my little, like, my bit on the COVID app, because I feel like there's a lot of excitement around apps that relate to this right now. And I think that companies who are new to the health area are trying to jump in. So thinking more broadly about what is the role of tech solutions when we're looking at COVID-19, when we're thinking about health. And I suspect that it comes down to thinking outside the obvious, that there's going to be sort of weird little niches, empty gaps where there is actually a tech solution if you can identify it. I mean, how do you identify it? You talk to the people. You talk to frontline responders to the COVID-19 situation, and you ask them, what do you need? For example, this isn't a tech solution, but it is something that people didn't think of until they started talking to healthcare providers, is there's this movement now to get skincare products to people who have to wear masks all day, because people were getting chafing and abrasions on their face from wearing the masks. And that makes it uncomfortable, it makes it painful, it makes you more and more at risk of adjusting the mask in awkward ways that might affect infection control. And so there's this whole movement to get high quality skincare donated to people who are spending 12, 14-hour shifts in a tightly fitted mask. And so that's something that you wouldn't have thought of unless you actually asked a healthcare provider. Since Ebola's come up a couple times, I'll bring up Ebola again. One of the low tech but tech solutions in the Ebola situation is that people were wearing PPE in West Africa, and it was really, really hot. And if anyone remembers the early days of the Ebola crisis, there was this whole like fear that somehow the Ebola virus was cutting right through the PPE, that people were wearing their PPE and getting sick anyway, and that like PPE wasn't working. And you know, that wasn't the answer. The answer was, it's incredibly sweaty inside that PPE, and people were getting hot and they were cracking it open so they could breathe a little. So it wasn't that the virus was getting through it, it was that people were taking it off, or they were opening it up just to gasp for air. And Doctors Without Borders actually started putting people in an ice vest under the PPE. Simple solution that made it much more tolerable and let them last a lot longer inside the PPE comfortably. And one of the things that was noticed later was that that innovation didn't spread among the Ebola treatment centers as fast as you'd expect. Like MSF was doing it, but everybody else didn't copy immediately. And there is, I think, a tendency where there's like one useful thing that's developed and it doesn't necessarily spread because everybody's busy on solving their emergency. Finally, the last thing I'd like to toss out there is that I think mobile money has been one of the greatest tech solutions we've ever run into in emergencies. And in particular, that like when you can get support to people who are directly affected by health emergencies, where you could help keep them from going hungry. And you know, that's not something that wasn't developed for international development. It wasn't developed for pandemics or complex humanitarian emergencies, but it turned out that it was a tool that already existed that suddenly had a very useful function. And then my very last point is, the fact that the information on COVID-19 is constantly changing is also an opportunity, I think, for a tech solution, which is, I think that right now we're starting to see people aggregating their set of updating links. The Johns Hopkins dashboard that's so famous. There's a lot of appetite for accurately, constantly updated information. And there aren't a lot of aggregators or functions that are actually curating and screening that for quality and putting it all in one place. There's lots of websites and blogs attempting to put it all in one place, but in terms of quality, and then in terms of actually pushing it to your phone or your device, something like that, I think there's less out there. So to sum it up, if we're talking about tech and COVID-19, I want to reiterate what Larissa said. Don't try to make people use something brand new when they're already desperately strained. Talk to the people you want to use it. Talk to the people who are actually trying to solve the problem, and maybe they don't have time to talk to you. Maybe frontline responders in COVID-19 don't have time to talk to you, in which case you have to think about how can you respectfully tap into that? Like, how can you respectfully ask for a little bit of time? And then finally, remember that health information and healthcare have specific vulnerabilities, specific data privacy requirements that don't necessarily apply in other situations. So I hope that was useful. I would love questions, and thank you so much, everyone, for letting me be here.
Great. So as Linda mentioned, my name is Allana Nelson, and I'm the Director for the Principles for Digital Development at DIAL, which is housed within the UN Foundation. I previously worked with Merrick and Larissa at USAID on the Ebola crisis in West Africa. And what I'm here to share today is just kind of what those lessons we learned with that was, and then how the digital principles relate. So for some of you that might not be familiar with the Principles for Digital Development, they're a set of 9 living guidelines that were created by the digital development community to inform how technology should be applied to development work. And this was really built on the back of a lot of failures or disruptions that we saw in the application of technology. Merrick highlighted some of those earlier. And they're really relevant today because the digital principles are actually primarily created by digital health practitioners. So in their current iteration with these 9 guidelines, they've been around for about 5 years now. And they serve as a really great framework for the responsible application of technology in development and humanitarian responses. I benefit from going last in this segment because I can actually respond to a lot of what our other speakers have said. And so I've actually been taking notes throughout. And I just want to highlight that while they're called the Principles for Digital Development, it's not just for development work. They're actually really evergreen ideas that apply to technology across the board, even here in the US. I wrote a series of tweets back when the Iowa caucus app fiasco happened, discussing how if we here in the US started to take our creation of technology a bit more seriously and start to apply these very basic ideas to them, we wouldn't run into this type of tech failure as well. And can you imagine that level of fiasco as it relates to a health emergency? And in a health crisis that would result in just a catastrophic and deadly effects. So the basics are more important than ever before. And while there's 9 digital principles, I'm only going to talk about 5 on this call because I think that they're really relevant based on what the other speakers have said up until now. And so starting with design with the user. So Larissa had discussed how important it was that people be trained, that they have trusted actors to encourage behavior change. And these are critically important issues when it comes to understanding your target user group, particularly in vulnerable communities where they might not trust information. But even here in the US, we hear about this fake news stuff all the time. We don't always trust the information we're getting from our government. And it's particularly hard when your governor is more trusted than the president who's supposed to be leading a national response. And so when you're thinking about technology solutions or how to address the needs of community, you really have to think about all of the ways in which they receive information, and and building your technology should be informed by their needs. We can't assume that what we have are the right answers. Those answers have to be informed by the communities we're trying to help. Users won't adopt or sustain a tool that is not useful to them, that they don't trust, or that doesn't meet their specific needs. So foundations, it's always important to start with your user. The next one that I think is really important that both Larissa and Merrick discussed as well was understand the existing ecosystem. So Larissa brought up that local barriers exist to adopting technology, particularly connectivity. And Merrick talked about there being existing digital health tools that have already been in use prior to COVID. And Allana also talked about some of those same tools that aren't always tech first as well, but can still be very effective. And it's important that as you start to think about, I have this problem I want to address, I think I want to create an app or something that can fix it, you take a look at what might already exist, because someone probably also has already had that idea, or there might be another tool in place that can just be adapted to meet those needs without having to rebuild from the ground up. Which leads us to reuse and improve, which is my personal favorite principle. And because it's really the idea that we don't always have to reinvent the wheel. So emergencies are a terrible time to trial and pilot new digital tools and programs. Allana talked about that, right, with the new COVID apps that are coming out, and people being very predatory in their behavior, opportunistic to try and increase their bottom line. And that's just not the best way to address the needs of communities. So healthcare systems across the globe are currently overwhelmed with meeting the needs of their citizens, and they don't have time to listen to tech pitches or evaluate the benefits of these new proposed technologies to meet their needs. What they really need, and what this time is for, is to invest more deeply in adapting our proven existing systems and tools. And a great example of this is mHero, which was a communications and reporting tool that was rolled out during Ebola, but it was built on the back of RapidPro, which was a iteration of one of the early systems that Merrick had talked about at the beginning of this discussion. So mHero was built on the back of RapidPro and used that system that already had existed in some of these countries. And so now the Ministry of Health in Liberia is using mHero to monitor for COVID. So they just created a new instance, but they took a tool that health workers already know how to use and have adopted widely, and they're putting that into practice for this, as opposed to creating a new COVID reporting app. So that's just one example that I have off the top of my head. Next issue is addressing privacy and security. We're really going to dive into this more in our third salon. And so I'll leave that deeper discussion for that topic. There's a lot of really great voices out there that are leading the charge on really advocating for user rights. But I will just say for now that it's important to balance human rights with privacy needs and saving lives. It's not easy to answer this question, and I'm not saying that there is an easy answer to it. But we have to remember how important it is to take seriously and have policies in place as you're rolling out digital tools for what your position is in protecting user privacy and how you're going to do that, and be very open and public about that. Finally, Merrick stated this at the end of his talk, but be collaborative is probably one of the most important principles that we need to put into place right now. Again, emergencies aren't the time to go it alone. They're not the time to increase your bottom line. Partnering with other organizations can actually lead to better digital products that will greatly benefit us all. No one organization is going to solve the COVID-19 crisis, but if we partner together and if we do this together, then we actually have a fighting chance at ending it earlier and saving more lives. So collaboration is more important now than ever before. The digital principles really have served as and continue to serve as a useful guide to inform how we approach and address this problem and problems every day. They existed before COVID, they're going to exist afterwards, and we continue to have them informed by the community. So if you're not already engaged with us on this topic, I welcome your engagement, because they are meant to be living guidelines. We plan to update and iterate on them over time, but just really would like to make sure that, we're relying on these evergreen ideas that were identified as being important for a reason. And in emergency situations like this, it just highlights why they were so important from the beginning. So I'll stop there. I know that I've been seeing a lot of questions coming in, and I'm excited to get to the discussion portion and get feedback from everybody else. So thank you.